Why should you avoid surgery during the summer season? Many people plan their surgeries during the summer holidays, thinking they will have more time to recover. However, this seemingly practical choice carries several serious health risks that are often overlooked. Modern medicine teaches us that every external factor influences post-surgical outcomes. And summer, despite the optimism it brings, is actually one of the most problematic seasons for undergoing surgical procedures. Here is why. High temperatures increase the risk of post-surgical infections. The body is more exposed to sweating, dehydration, and metabolic imbalances during summer. Heat and humidity create ideal conditions for bacteria to grow in surgical wounds. Studies have shown a rise in wound infections during the summer months, particularly in abdominal and orthopedic surgeries. Any infection delays healing and can lead to serious complications, including sepsis or the need for reoperation. There is a higher risk of dehydration and blood clot formation, also known as thrombosis. Heat accelerates fluid loss in the body. After surgery, patients are less active, which increases the likelihood of blood clots, especially in the legs. When this risk is combined with dehydration, the probability of deep vein thrombosis or pulmonary embolism rises significantly. Such complications can be fatal. Medical staff often work at reduced capacity during the summer. In most hospitals, July and August coincide with staff vacations. This often means you may not have access to the most experienced or complete medical team that would normally be available during other times of the year. Junior surgeons or temporary replacements may lack the necessary expertise for complex procedures. A successful operation is not just technical, it relies on coordinated experience. Healing is slower due to heat stress and air quality. In summer, the body expends more energy to maintain thermal balance. This reduces its regenerative ability. Additionally, increased air pollution and the presence of pollen, dust, and microbes can cause general inflammation and weaken the immune system. The result? A longer, more painful, and riskier recovery process. Wounds are more easily irritated by sweat and summer clothing. Sweating can directly affect surgical wounds, causing irritation, burning sensations, and even wound reopening. Many patients cannot wear light or breathable clothing after surgery due to dressings, placing them in an uncomfortable position during extreme heat. This significantly reduces comfort and worsens post-surgical well-being. There are greater risks for vulnerable groups, the elderly and children. Patients over 65 and children are more sensitive to summer risks such as hyperthermia, electrolyte imbalances, and generalized inflammatory reactions. Surgeries in these age groups during summer should be avoided unless absolutely necessary. An elective procedure is better postponed than turned into a life-threatening risk. Loved ones' vacations affect post-operative care. Family members and caregivers are often on vacation during the summer, making it harder to provide the physical and emotional support patients need after surgery. Lack of care or companionship can lead to complications, missed follow-ups, and hospital readmissions. Recovery does not happen only in the hospital. It happens at home with the help of others. So, when is the best time for surgery? According to most healthcare professionals, the safest seasons for surgical procedures are autumn and spring, when temperatures are milder, immunity is more stable, medical staff are more available, and the environment is cleaner and less physically stressful for the body.